welcome to Healthcare Cares. I'm your host, Trina Edwards Bulls, and I also have another host here who was speaking about the Medicare enrollment, which is so important, especially now. If you need to contact her after the podcast, please go to my Facebook page and have all her information. So, my certified experience is great. I'd like to welcome Jane Reese Wilkins. Go ahead, Jane.
Hey, Trina, I appreciate you having me on. So yes, I am a Medicare benefits consultant, and I'm just going to get right into it. I'm just going to give a little Medicare 101 today. I know it can be very confusing. So I'm going to start off with telling a little bit about myself. We're talking a little bit about myself. My name is Jane Reese Wilkins, and I am a Medicare consultant. So when you're turning 65 and you need your options, what I do, you come to me and I help you with your options. Or if we're in a time like this, right now we're in open enrollment. Open enrollment started October 15th, it goes to December 7th, then I can help you with comparing plans if you wanted to change your plan for one reason or another. I am certified with 13 plans. I have to take an exam every year just to be able to work with seniors, and I have to get certified in all the plans again every year when all the new benefits come out. So when you call me, I'm going to find out who your doctor is, all the medications you take, because if I recommend a plan, I want to make sure that I do not disturb your care. Okay, so I'm going to go on and start. Let's see. So the help that I give you is no cost to you at all. The plans actually pay me. So starting there are four parts to Medicare. Part A, Part B, C, and D. We're going to talk about that. We're going to talk about medical groups today, and we're going to talk about enrollment periods, plan star ratings, and then we'll talk about if you have any questions, I have no problem answering them at the end. Okay, so again, Medicare has four parts. That's Part A, Part B, Part C, and D. I'm going to start with Part A. So just for example, when you turn 65 and you have paid into Social Security for 10 years, let's say 40 quarters, you qualify to get Part A, and there is no cost for that. Okay, so that covers inpatient hospital, skilled nursing facility, home health care, hospice, anything that has to do with hospital. That's with the hospital, that's what that covers. Part B covers all your doctor visits, your labs, your x-rays, your outpatient services, urgent care, etc. When you first start on Medicare, if you call me and say, Jane, what do I do? I'm going to direct you to the Social Security office because that is where you access the Part B. Now, for Part A, there's no cost for Part A, but there is a cost for Part B, and that is $144.60 a month, and that is just the cost to have Medicare. Wow. If you make, as an individual, over $87,000 a year, or as a married couple, $174,000 a year, you will pay a slightly higher fee for Part B. Okay, so that's how that works. So now I'm going to talk about. So let's say, for example, you were supposed to enroll in Medicare, and your enrollment period came around and you did not enroll in Medicare, and you qualify for Part B and you don't have employer coverage, then what's going to happen is that every year that goes by that you don't enroll in Medicare and access your Part B through the Social Security office, they're going to tack on a 10% fee. So that would be 10% of $144, and that will go on every year, and that is a lifetime penalty. Now, the exception is if you have an employer plan. So there's a lot of people that don't retire until they're 68 or 67 or 69 or 70. And they'll call me and they'll say, Jane, I've had my employer plan, but now I'm dropping that coverage. I'm going to retire. Now I'm ready to get my Medicare. So as long as you can prove that you had insurance, some kind of coverage, then you're not going to get penalized.
Great.
Okay, so now I'm going to move on. So now I'm going to skip C for now, and I'm going to go to Part D. So Part D is the prescription drug plan, and it's the same thing. If you're not in a credible prescription drug plan, then you're going to be charged 1% a month of the national premium. The national premium, I believe, is $35, so that's going to be 35 cents a month. You will be penalized, and that is also for lifetime. And again, if you have VA benefits or employer coverage, you will not be charged that if you have that before. Okay.
Great.
So Part B, I'm sorry, Part D comes with Medicare Advantage plans. They come standard. These plans are categorized in 4 statements, in 4 stages. Okay, you have a deductible, initial coverage limit, and the coverage gap, and the catastrophic coverage. So what happens is when you're in your plan and you have a certain amount that you have to pay, the plan has a certain amount that they're paying, and together every year when you reach 4,130, then that means that you're going to go into the coverage gap, or they call it the donut hole. So if you're on prescription drug plans that cost a lot of money, you're going to find yourself in the donut hole. At that point, when you're in the donut hole, then you're going to pay 25% of the negotiated price of the drug until you reach the catastrophic phase. And I believe that is, the catastrophic phase is 6,550. Then what happens is, in a given year, once you reach the catastrophic phase, then you're going to go back to 5% of the cost. You will only be paying for generic, and then you will pay $9.20 copay for all the other drugs. Okay. All right. So Medicare supplement plans. When I speak with you and you're turning 65, there's going to be 2 options that you can that you have as far as plans. And this is Part C. There's going to be Medicare supplement plan options, and there's going to be a Medicare Advantage plan option. Okay, so Medicare supplement plans come in plan A to N. Medicare supplement plans are somewhat like PPO plans, okay? you get to choose your doctor, and you don't have to be with a medical group, and you don't have to be assigned to a primary care doctor. And there is a fee for Medicare supplement plan. And I believe the most popular fee that they have, there's a plan F. And I believe starting, it could be something like $170.
Correct.
So that means you're paying the $144, and then you're paying for the cost of the MedSup plan. They call it the MedSup, that's the nickname. And then you're paying for Part D, which is the drug plan. So that can run you, depending on which plan you pick, about $300 or $400 a month. Now there's some seniors that say, look, I have money. I don't mind paying that. I don't want to have to get a referral to go to the doctor. I prefer to have the MedSup plan, the Medicare supplemental plan. The other option is an HMO plan, okay? And that is Medicare Advantage plan. So that comes with all the parts, Part A, Part B, and Part C and D. You need all of that to have a Medicare Advantage plan. So when you first get your red, white, and blue card, after you have, made your appointment with Social Security, you apply for Part B. Now you have A and B, because you need Part A and B in order to get C and D. Okay?
Perfect.
So what happens is Medicare Advantage plans, they have 3 different types. You have your HMO plans, you have your PPO plan for Medicare Advantage, and then you have your special need plans. So Medicare Advantage plans, they do not have a premium in most counties in Los Angeles. So that is a cool thing. So that means you're only going to be paying the $144 every month, and there is no premium for that plan in Los Angeles County, in most counties in California, excuse me. So the great thing about Medicare Advantage plans is that it comes with Part D, okay? So you're not going to have to pay extra for Part D. It comes with it. And there is no premium for Part D as well. You do have to have a primary care physician, and you do have to be, and that physician has to be contracted with a medical group. I'm sure you heard of Healthcare Partners,
Right.
Rego. Those are examples of medical groups, okay? But the great part about Medicare Advantage plans, they come with lots of benefits. So they come with gym memberships, they come with a dental plan, they come with chiropractor services, they come with acupuncture services, they come with over-the-counter drug benefits, which is one of my favorites. There's some plans that give you up to $600 a year in over-the-counter drugs. So that means anything that you can go to the pharmacy and buy, whole medicine, vitamins, alcohol,
Right.
peroxide, whatever you need. So that's what so most seniors that don't have a whole lot of money to spend in their retirement, these plans are great for them because they almost supplement your income. They give you lots of great benefits. The role of a medical group. So medical groups like Healthcare Partners, that's where your primary care physician is going to pull your specialists from, like your orthopedic surgeon, your gynecologist, etc. So again, you have the 2 options. You can go with a Medicare Advantage plan, or you can go with the original Medicare and then go with the Medicare supplemental plan.
Good news.
So Medicare covers the COVID tests, so that's great. And those are the vaccine. When that comes out, it's going to cover that. And let's see what else. So there's here's some important terms. A co-payment is the set amount you pay for medical services. The co-insurance is the part that you are responsible for, that's the percentage of the plan that you're responsible for. An appeal, if you have a complaint, you can always make a complaint, grievance, and a complaint about the way your plan or your doctor is treating you. You can always complain about that. So here's some enrollment periods. Initial enrollment period is the enrollment period when you turn 65, you have 3 months before your birthday to enroll or 3 months after your birthday to enroll. Annual enrollment period, that's what we're in right now. That's from October 15th to December 7th. If you want to change your plan, now is the time to do it. If you missed your initial enrollment period and you got locked out because you waited too long, now is the time that you can get that plan right now. January 1st to March 31st, this is actually a new enrollment period. It's called OEP. It allows you to change your plan if you do not like your plan and you want to change your Medicare Advantage plan. It allows you to do that. But we do have special enrollment periods which open up special enrollments for you during the year if you have certain things that happen to you. So let's say you move to another state. They open up a special enrollment period for you to enroll. Let's say you come down with diabetes or heart disease. They will let you switch your plan in the middle of the year and go to a chronic plan. Let's say you have Medi-Cal. Medi-Cal allows you to change your plan every 3 months. It used to be every month, but they changed it. And I also wanted to go back to something about Medi-Cal. The $144 that you have to pay with Part B, if you have Medi-Cal, they waive that. So you do not have to pay the $144 or the co-pays in the plan if you have Medi-Cal, and then you're considered Medicare Medi-Cal. I'm sure a lot of you have heard that term. So these are the different plan star ratings. When you review the plans and we give you all the information after you enroll in the plan, we have to let you know what the star rating is in every plan. Okay? So I wanted to thank you for having me, and just to let you know that, there's a lot of people that get on plans and they stay on the same plan forever, but just know that your doctors are certified with, if they're with Healthcare Partners or with Rego, the doctors take whatever plans the medical groups take. So your doctors are certified with 13, 14 plans. So depending on your needs at the time, then just know you can always change your plan. And you can call me with any question and questions. So just thank you for having me today.
Oh, thank you for coming, Jane. I truly appreciate it. And you'll be seeing Jane on my next podcast. She'll be going over Cove, California, which will be great. If you haven't enrolled, she'll explain that to you. If you want to change your primary care provider, she'll explain that to you. And I have to give kudos to Jane. She did a great job. Now, you can go to my Facebook page and see Jane's presentation, or my website, or YouTube. So look out, everybody. I thank everybody for supporting me and keeping me going. I think that's a little bit. And one main thing I want you to take away with this presentation: please wear masks. Please wear masks. All of us have to help out everyone. And that's it. Take care. See you next week.